Welcome. I am Eugene Meyer, president of the Federalist Society, and I want to welcome you to this panel on regulation, or don't let a good crisis go to waste. Our moderator will introduce the panelists briefly, but for full bios and for recordings of all the previous panels, you can go to the Federalist website, fedsoc.org. This is the fifth of six panels we have over 2 days on COVID-19 and the law, and we are delighted to have moderating this panel Susan Dudley, who is the director of the George Washington University Regulatory Studies Center, and has been involved in one way or another with regulatory policy most of her professional life. Susan, take it from here.
Thanks very much, Gene. I'm happy to be here with a very distinguished panel. Let me quickly give very short bios. As Gene said, you can find out more about each of these people on the website. Paul Mahoney is the David and Mary Harrison Distinguished Professor of Law and former Dean of the University of Virginia Law School. He's published widely in law reviews and peer-reviewed finance and law and economics journal. And probably most relevant for our conversation today, he authored a book, Wasting a Crisis, Why Securities Regulation Fails. Then we'll hear from Cass Sunstein, who is the Robert Walmsley University Professor at Harvard and the founder and director of the program on behavioral economics and public policy at Harvard Law School. He served as administrator of the Office of Information and Regulatory Affairs in the Obama administration and has authored hundreds of articles and dozens of books. In fact, I think he writes faster than I read. Then we'll hear from Erica Litson, who's a professor at the University of Missouri School of Law, specializing in the areas of food and drug regulation, intellectual property, and administrative law. Recent articles have examined generic drug regulation and the costs and benefits of the new drug approval process. Then Roger Klein is the Chief Medical Officer of OmniSec, a faculty fellow at the Center for Law, Science, and Innovation at the Sandra Day O'Connor College of Law at Arizona State University, and a policy advisor at Heartland Institute. He previously served as the medical director of molecular pathology at the Cleveland Clinic and advisor to HHS, FDA, CMS, and the CDC. And last but not least, we'll hear from Sally Katzen, who's a professor of practice and distinguished scholar in residence at the NYU School of Law and co-director of the Legislative and Regulatory Process Clinic there. She has held several senior positions in the Clinton administration, including administrator of the Office of Information and Regulatory Affairs and deputy director of OMB. So as Gene said, this panel will look at government regulation during the COVID-19 pandemic. I'll take just a few minutes to set the stage before turning to the other panelists. While the economy has clearly slowed in response to the pandemic, government regulators have not slowed down, nor have their critics. Some of that does appear to be opportunism, following Rahm Emanuel's famous observation that you don't want a serious crisis to go to waste. Gene shared with me just yesterday a City of Seattle bill that's expected to pass on Monday, requiring restaurants to pay food delivery gig workers a $5 premium for every delivery. And they have to do this without reducing the areas served, without reducing a gig worker's compensation or earning capacity, and without increasing customer costs. So it's a win-win-win. It makes one wonder why, if it's so easy to repeal the law of supply and demand, we needed a crisis to make it happen. At the federal level, President Trump issued a proclamation suspending immigrants' entry into the country on the grounds that they present a risk to the US labor market. And the Wall Street Journal reported just today that he may use the crisis to suspend more employment-based visas soon. And the CDC issued emergency rules allowing its director to prohibit travel from countries at risk of bringing communicable disease. But agencies have also been waiving existing regulatory requirements that might impede responses to the health crisis or be difficult to comply with while social distancing. I have a slide that I think, if We can get that up now. That shows, you can see this increase in regulatory activity in the slide. It shows the number of significant rules completed in the months of February through May during the 4 years of the Trump administration. So in that, you can see there's an increase in overall regulatory activity in 2020 compared to previous years. Then the tan layer at the bottom of the columns represents proposed rules. There's not a terribly big increase over last year there, but what we see is a dramatic increase in interim final rules. That's the light blue band in the middle of each column. And unlike most regulations, those are rules that take effect without waiting for public comment. In this case, they're generally temporary, like rules issued under FDA's emergency use provisions. And it's probably not surprising to see these interim final rules used to address emergency pandemic-related issues. But President Trump recently issued an executive order directing agencies to evaluate whether any of these should be made permanent. And then finally, the top blue layer represents final rules, and that's also higher than the first 3 years. These are mostly driven by incentives other than the pandemic. So depending on the outcome of the election in November, the administration may only have a few months left in which to complete its regulatory or its deregulatory priorities. So let me show you one more graph. Thank you. This one shows the annual count of economically significant rules. And you can see there's a sharp uptick in regulatory activity, usually at the end, in the final year of an administration. That's the taller red columns that you see. So for this administration, the window for issuing final actions that are likely to stick may already have closed due to a 1996 law that gives Congress expedited procedures for rescinding recent regulations. Under the Congressional Review Act, the next Congress could overturn a recent rule if simple majorities in both chambers pass a joint resolution to disapprove it, and if there were a new president willing to sign that disapproval. So that's my basic background. Let's now turn to Professor Paul Mahoney to explain why crises are a terrible time to regulate.
Thank you, Susan. And I'd like to thank the Federalist Society for inviting me to be a part of this discussion. I study the regulatory response to financial crises, but I hope some of what I've learned might be relevant to our current situation. In the panic phase of a financial crisis, the executive branch takes the lead in dealing with what we might think of as acute care. Congress, of course, may authorize funding for emergency relief or for fiscal stimulus, but the executive is responding to events in real time. After the panic begins to subside, Congress steps in to assess what went wrong and to legislate with a view to preventing a recurrence. Now, unfortunately, post-crisis financial legislation is invariably overstuffed. It typically consists of a core of one or two sensible ideas surrounded by layers of, at best, irrelevant and at worst, counterproductive provisions. And I hope that anyone who's familiar with the Sarbanes-Oxley and Dodd-Frank Acts will not think of that as an unduly harsh assessment. And it's also nothing new. Even the Securities Act of 1933, which was one of the first statutes enacted by the New Deal Congress, fits the pattern. Its core idea is that companies selling securities to the public should make specified disclosures to the buyers. But James Landis, the Harvard law professor to whom President Roosevelt and committee chair Sam Rayburn outsourced the drafting, had quite firm views about how companies should do public offerings. And he drafted those views into the legislation. This was entirely unnecessary from the perspective of generating full disclosure. And it turns out that the largest investment banks found it easy to comply with the new restrictions, but smaller investment banks didn't. And they were driven out of the business in droves, even as the stock market began to recover. And this reduction in competition is a standard consequence of post-crisis financial reform legislation. Another consequence is an increase in the power, staffing, and funding of federal agencies, even those, and perhaps especially those, that did a poor job of oversight before and during the crisis. And whatever else one might say, this does not create especially good incentives for the regulators. So why does this happen? What's the reason? One simple hypothesis is that post-financial crisis legislation is enacted against a backdrop of public anger that distorts the policy formation process. It certainly distorts the rhetoric. New regulations are generally described as a means of punishing the commercial banks or investment banks that Congress blames for the crisis. Now, this is just an inaccurate way of describing what regulation is designed to do, but it does fit the mood of the times. A corollary to that is that Congress, in the immediate aftermath of a crisis, assesses new rules based on how tough they are, meaning in practice how numerous. And that plays directly into the hands of existing regulators, as well as lobbyists and activists, all of whom at any given moment in time have a variety of policy proposals sitting on the shelf that they've pitched to Congress unsuccessfully, but that now can be taken down off the shelf and repackaged as a response to the financial crisis. Roberto Romano has described that process in detail in the context of the Sarbanes-Oxley Act. It's a recipe for bad policymaking. Well, what does this tell us about our present predicament? As David Hyman pointed out in our first panel yesterday, the CDC and FDA made quite a few mistakes that contributed to the slow and chaotic rollout of testing and shortages of equipment. The current administration has focused on reducing regulatory barriers that might interfere with an effective private sector response. But I would just caution that it is still early days. At some point after the election into 2021, it would be natural for the CDC and the FDA to mount a counteroffensive, arguing that the private sector is to blame, and had they simply had more control and more funding, everything would have gone more smoothly. Well, that point's, I think, fairly obvious. The less obvious point I want to make is that if the history of financial crises is any guide, whatever industries Congress chooses to blame will not put up as much resistance as you might expect to an expanded regulatory system. They will be aware that expansions of the reach of regulatory agencies generally produces less competition in the regulated industry, to the particular benefit of the largest firms who, of course, do the most lobbying. And that's the lesson we learn from financial crises.
Let me unmute myself. Thank you very much, Paul. All right, next we are going to hear from Cass Sunstein. Cass.
Great. Thank you to the Federalist Society for having me. And I have a little project that I am engaged in, and I hope we will have national energy for. We need to introduce a term. The term is sludge. And that term refers to paperwork requirements, reporting burdens, waiting time, administrative burdens that are causing hardship for businesses, small and large, that are often having disproportionately adverse effect on poor communities and people of color. And we need to have a war on sludge. So let me say a little bit about what we know and then about the pandemic. So the current administration recently released the uh, document that I know everyone waits for. It's like a Stephen King novel or, an amazing television show. It's called The Information Collection Budget of the United States. And what this fascinating document, fascinating to me, possibly to Susan, maybe to no one else, what this document does is to create a kind of sludge audit. It's limited to paperwork requirements, but it describes both the aggregate level of paperwork burdens imposed on the American people, and it distinguishes among agencies. The number, I'd love it if you'd all remember, is 11.4 billion. That's the number of hours in paperwork requirements imposed by the federal government on the American people. Now, if you took almost any large city and put every member of that city in a room, children as well as adults, and asked them to spend all working hours for, let's say, 2021, filling out federal forms, you wouldn't get close to that 11.4 billion hours. The reason it's so damaging is that the time tax it imposes on people, if you use the Bureau of Labor Statistics number of $27, multiply that times 11.4 billion, that's a lot. That's more than the budget of many federal agencies. The time tax is very serious, and that understates things in two different ways. One is that it's not just time. It's often frustrating, stigmatizing, humiliating, and dignity impairing time, especially for people without a lot of education or with some kind of impairment. They might be old, they might be sick. And in addition to that, and this is the fundamental point, if you're an entrepreneur trying to energize something, or if you are a small company trying to do something new, or if you are a large company trying to innovate, the time tax doesn't adequately capture the adverse effect. It may be that take-up of federal benefits programs, which can turn people's lives around, maybe involving training or education or just resources, is prevented by the sludge, that the requirement of navigating something is so daunting, you don't go to college, or you don't get training, or you don't get benefits that might be necessary for you to manage the economic situation for your family. Okay, the good news, now turning to the pandemic, is that we've seen what appears to be mostly a bottom-up war on sludge on the part of the US government. And by bottom-up, I mean this hasn't been, so far as the public record shows, officially managed by the White House or the beloved Office of Information and Regulatory Affairs. I'm hopeful that they're alert to it and approving of it, but it seems to be that the deep state has been conducting a set of skirmishes against sludge. This might mean simplification and waivers. It might mean elimination of paperwork requirements so that, for example, you don't need an in-person interview to get SNAP benefits. That's actually true. You don't need an in-person interview anymore. It might mean that hospitals and doctors don't have to comply with paperwork and reporting requirements that were formerly imposed on them. It might mean that a beautiful thing, telemedicine or telehealth has suddenly been liberated, not from regulatory requirements, but from sludge impositions, where sludge impositions were the source of the problem. Now, this is just a capsule account of what should be a book, which is the Sludge Skirmishes of 2020. And let me explore a little bit why we've observed it. One reason is that the cost-benefit calculation clearly justifies it. In circumstances that are normal, very careful insurance of program integrity is justified. In circumstances of death, to waive a little bit and maybe sacrifice at the margin in terms of eligibility. Some people are going to be getting benefits who shouldn't. That's okay if that's the price of ensuring that many, many people are getting benefits whose life depends on them. So a rough and ready cost-benefit calculus done for the first time, I think, in a rigorous way in some of these domains is warranting sludge reduction. The second and more interesting thing is many people face cognitive scarcity under conditions of pandemic. They might be sick, they might be elderly, they might be suffering from a mental health problem, they might have an educational limit, that is, they don't know a whole lot. So sludge navigation is especially hard for them. In conditions of pandemic, that problem of cognitive scarcity, let's call it, it's not a lovely term, is especially poignant. It suggests that the harm done by sludge is much higher than it would be under normal circumstances. Okay, post-pandemic, we need skirmishes against sludge. And I'm going to suggest two armies. Army number one, the executive branch. The executive branch should be calling for systematic sludge audits. And by executive branch, I mean aspirationally the president personally, who should be giving high-level attention through presidential memorandum or executive order to that 11.4 billion hour figure and directing agencies either with particulars or with more generalities to find ways to reduce that and to report in 6 months. The idea would be that if the president, for any number of reasons, doesn't do it, then the administrator of the Office of Information and Regulatory Affairs or the director of the Office of Management and Budget should do exactly that. Signaling, and this is the second military force, we've just talked about the Marines, now we're going to talk about the Navy SEALs. The Navy SEALs are the United States Congress. This is hopeful and optimistic, where what the Navy SEALs will do is direct some sort of cost-benefit justification and cost-effectiveness requirement for sludge. Whether it should be judicially enforceable is a nice question, but the Paperwork Reduction Act should be amended to make very clear that cost-effectiveness is mandatory for sludge and that some kind of cost-benefit justification is also mandatory. So for every million hours of paperwork imposed on, let's say, small companies or big companies or labor unions or people dealing with the Department of Labor, there's a reasonable justification in benefit terms. Okay, I want to end by posing a question to the group, which I think has special, what's the right word, emotional content, given the number of our fellow citizens who are sick or who have died. And that is, what's the most precious commodity that human beings are blessed to have? What's at the top of the list? It's time. Let's find a way to give our fellow citizens more of it.
Thank you very much, Cass. Next, we will hear from Erica Litson. Erica.
Thank you. It was a hard act to follow. In addition to being a law professor, I want to add to what Susan said that I practiced law for 18 years beforehand and was a partner at Covington and Burling. What that means is that I have spent decades thinking about the regulation of medical products, meaning drugs, vaccines, medical devices, like diagnostic tests and ventilators. And I'm going to talk a little bit about medical product regulation in this country. In this country and in most countries that have modernized healthcare systems, medical product regulation starts from a basic premise, which is that all medical products have risks. We often talk about making sure that these products are safe and effective, but we actually don't really mean that. Why not? Essentially because products are, no product is completely safe. No product is completely effective, all right? They are terms that mean something only relative to each other. So for example, if I tell you a medical product might cause heart damage, not fatal heart damage, but heart damage, in 1% of patients, you might think, well, it's not safe to treat sunburn, but you might think it was safe to treat brain cancer that was otherwise terminal. All right, so that's the first reason we don't really mean it when we say safe and effective. We mean something relative. The second reason is we can't know everything that there really is to know about a new medical product, no matter how many trials we run, no matter how much testing we run. In fact, we frequently don't fully understand a new medical product, even if it's been on the market for years. There can always be surprises. So the regulatory paradigm for medical products in this country works from that assumption that safe and effective are good goals to talk about, but really what we want is something more nuanced. We want medical products to be, on average, good bets. We want their benefits to exceed their risks. And of course, at the individual level, I would say a rational person will choose to take a medical product if the benefits to that person outweigh the risks. When the federal government, meaning the Food and Drug Administration, FDA, permits a medical product on the market, it is, because of what I just said, choosing to accept some risk. And when a doctor selects or a patient takes a medical product, that person is also choosing to accept some risk. And although we can never really know everything there is to know, testing medical products leads to information about their benefits and their risks and helps lead to these more rational decisions. And I want to be clear before I say anything more, which is that there is such a thing as high quality scientific evidence about medical products. The gold standard for proof of a drug's effectiveness is a placebo-controlled, double-blinded trial in humans. And we can talk more about why that kind of evidence is so good if people care about it. But anyway, what I want to say ultimately is that the federal government, meaning FDA, grounds its regulation of medical products in those basic assumptions. And it's trying to balance the benefits of testing with the costs of testing. What are the costs? Well, one, having to do years and years of testing drives up the cost of bringing medical products to market and contributes to the price of those products when they reach us. And two, testing delays our access to medical products. The debate over the state and then ultimately the federal right to try law, the state laws first, really, I think, brought home to a lot of us the fact that people disagree about the relative weight that should be given to avoiding delay and the weight that should be given to getting the highest quality information possible. And for patients facing certain death, avoiding delay may be more important than having the highest quality evidence on which to make a decision. So choosing the right regulatory approach with respect to medical products requires balancing the costs and benefits of the regulatory approach that's being taken. And when I was asked to join this panel, the prompt for the panel, the question we were asked, it started with the observation that historically government has almost always increased its power during crisis and then kept some of the power afterwards. For me, though, one of the most interesting aspects of COVID-19 has been the willingness of regulators, of government, including FDA, instead to deregulate. And it's been especially interesting with respect to medical products. But what do I mean by the willingness to deregulate? Taking an example other than medical products, in my hometown of Columbia, Missouri, the city government decided to suspend enforcing the parking meters downtown. And my law school, I think like every other law school, switched to delivering every single class through Zoom and other internet-based platforms, even though the American Bar Association, which regulates law schools, has pretty strict rules that technically don't permit that. The ABA quickly made it clear that it wasn't going to enforce the rule. How could it, right? To some extent, COVID-19 had the same effect or a similar effect at FDA. For example, the agency suspended some of its programming, meaning activities like routine facility inspections. And it waived some requirements that would otherwise ordinarily apply. So, for example, back in April, it relaxed its approach with respect to smartphone apps that are intended to treat disorders like depression and anxiety and insomnia. It issued an emergency guidance basically saying it was going to exercise enforcement discretion and the app developers would not have to go through FDA pre-clearance or pre-approval requirements, all right? To give another example, it created a relaxed enforcement policy for x-rays and ultrasounds and MRI systems. This was done so that COVID-19 patients could be imaged away from large healthcare facilities. And as many people know, it permitted a variety of medical products to reach doctors and patients without the usual amount of testing ahead of time, without the usual wait for data and paperwork. It seems to me that this kind of choice, this different trade-off in an emergency situation, provides excellent material for reflection. Because we tested out new approaches, new and less restrictive ways of doing things. The circumstances were unusual, to be sure, But my point is that regulators, and not just FDA, have spent a lot of the last 6 months adjusting their usual requirements, relaxing their enforcement, and in a sense, settling for good enough under the circumstances. And I think that we ought to ask the obvious question before reinstating a lot of the rules that were in place before: did the sky fall? I'll have more to say in Q&A and discussion, but my suggestion is that policymakers and the public think about the rules and the restrictions and requirements that were lifted, and as to each, take some time to study what happened and think whether we might be better off if at least some of them were not put back in place.
Thank you very much. Really interesting, Erica. All right, Roger, who will also talk to us about some medical issues, I think.
Thank you, Susan. And thank you very much to the Federalist Society for inviting me to this, to present in this forum. In many ways, the election of President Donald J. Trump represented a challenge to, if not an outright repudiation of, the philosophy of governance by subject matter experts that has characterized the administrative state. Over time, power has centralized in administrative agencies which have been called upon or have taken it upon themselves to make policy decisions impacting broad swaths of American society. This was ostensibly necessary because of supposed unique bureaucratic competence to address arcane technical matters. However, it appears to have been as much the result of conscious congressional abdication of responsibility for politically difficult public policy choices. At no time has the public skepticism toward expert rule seemed more justified than during the COVID-19 pandemic. We began the epidemic in the United States with our largest and most prestigious public health agency, the Centers for Disease Control and Prevention, reassuring the country that the coronavirus had barely reached our shores and was not disseminating here. We subsequently learned the opposite was true. As the virus continued to spread undetected in the community, precious weeks were lost before we could take measures that may have contained or slowed the burgeoning epidemic. Perhaps just as important, we relinquished the opportunity to gain knowledge about the characteristics of the disease, its severity, its lethality, and its level of transmission, all because of a Food and Drug Administration decision to place clinical diagnostic testing exclusively in the hands of the CDC. On February 5th, FDA designated CDC a diagnostic test manufacturer and dubbed it the COVID-19 Central Laboratory for the nation. The agency was to supply its tests to an army of public epidemiology laboratories that would handle the country's patient testing, thereby circumventing and supplanting the private system of hospital and commercial laboratories and test manufacturers that under usual circumstances perform almost all medical testing in the United States. In an outcome reminiscent of the failures of central planning in the former Soviet Union, socialized testing did not turn out well. Public health labs were unable to validate CDC's contaminated reagents and could not deploy the agency's tests. As a result, little testing took place here until FDA opened the field to private laboratories and in vitro diagnostic test vendors in late February and early March. At this point, the clinical laboratory industry rapidly ramped up to perform millions of tests, an unprecedented and astounding feat that was a testament to the dedication and ingenuity of the skilled professionals in the industry and the great heights to which Americans can soar when left to do their jobs unencumbered by the redundant and unnecessary, quote, protections, unquote, of a largely ineffectual bureaucracy. We were warned the SARS-CoV-2 virus kills 3 or 4% of those it infects, and that we could expect over 2 million Americans to die from it. But even subsequent speculation of a 1% death rate never made sense. Estimates were derived from limited faulty data, and case and fatality numbers were obtained by testing mostly the sickest patients. The CDC now estimates the infection fatality rate of SARS-CoV-2 at a more influenza-like level of less than 0.3%. That is fewer than 3 of 1,000 infected people. Moreover, deaths are heavily concentrated among the sick elderly, with the overwhelming number of infected individuals experiencing mild illnesses or no symptoms. The, quote, expert, unquote, mathematical modelers who projected millions of deaths also told us we would need thousands of ventilators and would run out of hospital beds and supplies as doctor gods chose who would live and who would die through allocation of grossly insufficient health resources. Despite admitted problems in uniquely population-dense New York City, with its heavy reliance on public transportation and large numbers of low-income, multi-generational households living in small quarters, the doomsday scenarios never came to pass. Instead, nearly 60% of states still have fewer than 1,000 attributable fatalities. Residents of inadequately protected long-term care facilities account for about 40% of deaths nationally, and much higher proportions in some states. In epicenter New York, a gubernatorial executive order sent over 4,500 recovering COVID-19 patients to vulnerable nursing homes to avoid discrimination and preserve hospital beds that were never needed. This move almost certainly resulted in the unnecessary deaths of perhaps several thousand elderly residents. Politicians and public health officials imposed draconian economic lockdowns, initially with the laudable short-term goal of avoiding overload of the healthcare system. But these restrictions were unjustifiably and indefinitely prolonged without support of empirical data to, quote, save lives, unquote. Unemployment skyrocketed to depression-era levels, not due to the virus, but because of expert-directed action that confined people to their homes, unable to work as politically designated non-essential businesses were shuttered. Lack of money and home confinement, at times with significant numbers of people crowded into small spaces, set the stage for mass protests, riots, and looting. These activities were then defended by the same public health experts who had just warned us against leaving our houses and who had imposed and encouraged jailing of the dangerous rebels who dared open their businesses in order to feed their families. This, while simultaneously recommending the release of convicted criminals to prevent them from contracting what for most turned out to be a harmless disease. The 180-degree turn from explicit instructions not to wear face masks to legal mandates to don them is but one of many examples of expert-directed, authoritative pronouncements that were reversed without adequate explanation. Most recently, economic experts told us another 4 million jobs would be lost in May. Instead, the United States experienced its largest single month of job gains in our history amid a falling unemployment rate. Is it any wonder ordinary Americans are confused and distrustful of the overconfident, smooth-talking experts who hold so much power over their economic and social destinies? Studies support the value of skill-based expertise. If you need your heart valve replaced, you're likely to fare better with a surgeon who performs a lot of valve replacements, an expert. Similarly, results will probably be superior with a mechanic who is practiced in repairing the make and model car you drive. However, pronouncements of so-called experts about unanswerable questions are rightly questioned and appropriately challenged. Given the preceding, we should welcome doubts about, distrust of, and skepticism regarding regulations, quote, the experts, unquote, promulgate, or those for which they advocate. We must demand empirical evidence that convincingly supports governmental imposition of costly mandates or life-altering abridgments of civil liberties and individual freedom. Vigilance and guarding against arbitrary or unwarranted regulatory encroachments is essential to the preservation of a free society. Thank you.
Okay, thank you very much, Roger. All right, Sally, take us home.
Well, thank you. And I am delighted to be here. As always, I want to acknowledge my appreciation that the Federalist Society welcomes different viewpoints. And once again, I have a different viewpoint from some of the other members of this panel. I would note at the beginning that the panel is called regulation. But what we're looking at, as Erica mentioned, is deregulation. And most of the items in Susan's opening charts of final rules and interim rules are deregulatory in nature rather than imposing new obligations or responsibilities on people. Now, there is one thing that a lot of us agree on, and that is unnecessary or burdensome or costly regulations are not good. So eliminating rules is not bad during a crisis or otherwise. Cass, Susan, and I, during our respective tenures at OIRA, all launched efforts to find regulations that were out of date or unnecessarily burdensome or costly and get rid of them. But in each instance, the question was one that was referenced in Cass's comments. And that question should have been asked: are the costs imposed by the rules on the regulated entities offset or justified by the benefits in health, safety, or the environment that the rule provides? If those costs are not justified, the rule should be eliminated. But if they are justified, the rule is contributing to the betterment of the nation as a whole. And while perhaps it should be modified or amended, it should not be eliminated. So with that perspective, I found myself, as Erica did, looking at the prompts, and I was focusing on the second part of the description of the program that begins, on the flip side, there are regulations that have been lifted. Should they remain lifted in some situations? And it then identified, among others, FDA approvals, including the practice of medicine across state lines, which Cass mentioned, and I have personally been able to take advantage of during this crisis. What struck me about the question in the prompt was the assumption of individual valuations of specific rules, of a scalpel, rather than a sledgehammer, of a careful and thoughtful consideration of the merits of each candidate for reconsideration. Regrettably, the track record of this administration with respect to deregulation cannot be so described. There's nothing subtle or surgical about its approach. The only thing that this administration has considered is the costs or the inconvenience of the rules. Benefits are ignored. From the very first President Trump executive order on the subject, the so-called 2-for-1 and regulatory budget EO, he said costs 17 times. He said benefits 0. And this approach to deregulation, ignoring the foregone benefits, focusing only on the costs of the regulated entities, has consistently prevailed throughout President Trump's term in office, before and during the COVID crisis. Now, the president often says that what he's doing is unprecedented. In the case of his deregulatory efforts, I would say that's absolutely true. It is unprecedented. I think he has the lowest net benefits ever in history, as long as they have been measured. I do not expect that to change throughout this term and the next term if he has one. So the question whether regulations have been or will be lifted because of COVID should remain lifted after the crisis is past strikes me as more hypothetical than real. The impulses of this administration have been, are, and will continue to be to deregulate using whatever justification comes to hand. Remember, there were lots of rollbacks of Obama-era regulations even before the current crisis. One of the first actions taken by the Trump administration was to deep six an Obama-era rule that was ready to be released to protect workers in healthcare centers, including nursing homes, during an airborne infectious disease pandemic, similar to the rules already in place for protecting against bloodborne pathogens such as Ebola and hepatitis. With hindsight, that may have saved many, at least some, lives. The Trump administration also moved to reduce car fuel economy standards adopted by Obama, which the Trump administration had proposed well before COVID, but was finalized and released during COVID, notwithstanding the predicted benefits of the pre-existing rule in reducing respiratory diseases. Again, there's nothing about this rescission that was responsive to or caused by the COVID crisis. Now, on the other hand, the current pandemic is the purported justification for more than 600 deregulatory actions the administration has taken. The number comes from the White House itself. Two examples, which I found particularly interesting was FDA's 5 instances of loosening labeling and information rules for food manufacturing, including, among other things, undocumented substitutions of ingredients in products. And DOT's lifting of the limit on truck drivers' hours of service, which were put in place after a detailed cost-benefit analysis, not only to protect the truck drivers, but also to reduce accidents and deaths of others on the highway. Will any of these rules be reinstated when we emerge from COVID? I'd hazard a guess that the answer is no. None. Not if this administration is in place. In fact, his recent executive order, which I think both Susan and Erica mentioned, directs the agencies to review their 600 pandemic deregulatory actions and determine which, if any, quote, would promote economic recovery if made permanent, close quote. Now, if that's the criterion, would businesses recover better or faster if they did not have to comply with regulations? The answer would most likely, I would say certainly, be yes. Again, though, what happens to the foregone benefits in this calculation? It should be apparent, I believe, that virtually every deregulatory action taken by this administration will stand after the crisis is over, unless and until there's a new administration. And they will stand whether justified legitimately or pretextually by COVID, even after COVID is, God willing, gone. Again, I don't object to deregulation where appropriate, where undertaken with the benefit of analysis, where carefully considered in the case of a scalpel. But little, if anything, has been done to date by this administration in the name of responding to the crisis that can be so described. They are on a course and are likely not to deviate from that course. Now, 2 other quick points, if I may. First, we've been speaking about issuing or the retraction of regs, but there's been scant reference to the fact that many regs remain on the books. They were issued for good reason, and they are the law. Yet because of the pandemic, they're not being enforced by federal agencies. Lots of rules, lots of agencies with virtually any excuse. Environmental health and safety rules are all there, but they're not there, depending solely on the whim or wish of the regulatory agency. That was the way it seemed to be, again, before the pandemic, and even more so since. The president's executive order a few weeks ago reaffirmed and seemingly blessed this new paradigm. It specifically provides that the heads of all agencies shall consider exercising appropriate temporary enforcement discretion for the purpose of promoting job creation and economic growth. All well and good for the business, but what about the employees, the customers, the neighbors for whom these rules were adopted in the first place? Again, the costs trump, pun intended, the benefits, even if the benefits are vastly greater than the costs. The news has pointed to OSHA and EPA have been singled out for their forbearance in enforcing existing rules. Is it too difficult or inconvenient to monitor, to report, to remedy excesses in emissions or effluents? Not to worry. We will forbear if you tell us you tried. I am reminded, and as a law professor, forgive me, but I am reminded of Justice White's comment in the State Farm case, where he said the automobile industry has opted for the passive belt over the airbag. But surely it is not enough that the regulated industry has eschewed a given safety device. For nearly a decade, the automobile industry waged the regulatory equivalent of war against the airbag. Now they've decided to employ a seatbelt system which will not meet the safety objectives of the statute. This hardly constitute causes to revoke the standard itself. Indeed, the act and the implementing regulation, I would add, was necessary because the industry was not sufficiently responsive to safety concerns. The same, I think, can be said here. Are we going to abdicate enforcement based on the predilections or preferences of the regulated entities? Well, apparently so. In the name of the pandemic or the need for robust, prompt economic recovery. Now, I, for one, am not comfortable with going down that road, even if it were lawful to do so. Finally, for me, the proof of the pudding that all this deregulation is not based on neutral principles and the exigencies of the times. The fact is, new regulations and enforcements abound where they fit neatly with the pre-existing ideology of the administration. We are seeing new regulations and enhanced enforcement in certain areas. I refer to the public charge rule, which was issued before the crisis and would substantially increase the difficulty of getting a green card or, once here, getting any medical assistance. 2, the reduction of food stamp benefits. What a propitious time for that when people are being laid off and can't make ends meet, no matter how good their intentions and how strong their efforts. And the host of immigration rules to do whatever. These will likely continue in the face of or in the aftermath of this crisis. At least that's my prediction. Thank you.
Thank you, Sally. I wish that you would be a little less timid in your views. So we've now heard from everybody. Let me invite people who are listening, at least if you're listening on Zoom, you can join, you can ask us some questions by, if you're on the computer, click the raise your hand button and I'll be able to see it. And if you're on your phone, press star and then 9. But before we actually take your questions, I'd love to go through the panel again and see if people have comments for each other. So Paul, you warned us that crisis is a terrible time to regulate, and yet most of us were talking about deregulation. Have you got any thoughts based on what others said?
I guess I would just reiterate that we're still in a period of great uncertainty where I think it is a matter of responding to events rather than asking, what went wrong here? There will be time for the latter, and that's when I think the dynamics that I've identified are going to come into play. I'd also just very briefly want to make the point that I don't know that there's always a strong divergence between the interests of economic recovery and the interests of sort of net benefit to society. At least in principle, a lot of health and safety regulation is in the sort of collective best interests of the industry because it makes consumers more confident in using a product or service. But individually, it may not be in the interest of any given producer. So while there certainly are plenty of opportunities for a wedge to develop between those two things, I don't think they're always diametrically opposed.
Thank you. Let's just kind of go through as we started, which I think after we heard from Paul Cass, I think you were next. Do you have thoughts on what others have said?
Yeah, I'd say that there are 3 kind of ideas that emerge that are kind of unified the group. The first is that it might make sense to have at least an incrementally higher degree of caution about new regulatory requirements amidst an economic terribleness, partly for Paul's reason, partly for Roger's reason, epistemic, and partly just the country's under a lot of economic strain. And if you impose a host of new costs on people, it's not some abstraction business that's hurt, it's consumers and employees as well. So I use the word incrementally higher degree, not a moratorium or anything for Sally's reason, but caution. Second point is that with respect to deregulation, I think the cautionary notes from Paul apply there too. You don't want to, in the midst of high emotion, to do something that is insufficiently reflective. But I think consistent with some of the things we've observed, to have an incrementally higher degree of receptivity toward deregulation isn't a bad idea because of the economic situation. And also the word incremental deserves big bold letters. Don't take the Clean Air Act away. Don't make the people sick in the air, but a little more maybe foot to the pedal than had been previously. Now, if the foot is already well to the pedal, then you don't need to do incrementally more. But that would be the direction. And the third idea is that insofar as we're talking about paperwork requirements and reporting requirements, that's in a way the lost island, I think, of deregulatory energy. Because if you do things in those domains, it might involve research and education, it might involve entrepreneurs. It doesn't run into, I think, the salutary, that word is too close to the word Sally, but I mean Sally. Sally's salutary cautionary notes, which point to net benefits. So there is a real opportunity here to energize a project which Democratic and Republican administrations haven't really engaged aggressively enough in, and I include myself, which is the reduction of administrative burdens on the American people.
And then I'll just add one more thing, and maybe it's related to your two. I think I heard from both you, Cass, and Paul, that we have to be concerned that often that these regulations aren't anti-competitive and aren't helping the companies or the people who have the wherewithal to comply with them and leave the others out in the cold. I thought that was something I heard from both of you that was interesting. Erica, any thoughts?
Sure. I think one of the things that I heard from most of the panelists was the notion, certainly it's my view, that in a crisis situation, you don't want to make sort of permanent changes that are not reflective, not thoughtful. And that has always been my view. I think major regulation or deregulation that is meant to be enduring now and during a crisis is not the time for it. What I really think here is that if you're committed to a rational approach to regulation, you always have to go back to the basic question. What problem are we trying to address with this regulation? What are the costs and the benefits of the approach we're trying to take? Are there other approaches that we could take with lower costs and similar benefits or good enough benefits? And I guess what I ultimately think is that we have this sort of 6-month laboratory of experiments that at least give us some data to think about, well, was this change, was this little bit of deregulation that was adopted, did it work? Did it fix did we still address whatever that underlying problem was adequately? And what does that tell us about what we should be doing going forward? I like thinking of it as a sort of a 6-month laboratory and fuel for a conversation, maybe a more informed, more thoughtful conversation about how we should regulate going forward.
Yeah, I think that's an excellent point. And the other laboratory that we're seeing is different states' responses to the pandemic. And so that's another way that we can learn from experimentation. Roger, give us your thoughts.
So I have a couple of points. First of all, Paul, I thought was right on. Right now, we're in a time of tremendous emotional contagion, as we can see by just looking at a television screen. And I think it's an exceptionally risky time to make permanent and far-reaching decisions. The risks of bad decisions are very high right now. So I think we need to be extremely careful in that regard. With respect to CAS, so I read the Sludge paper in the Duke Law Review, which I thought was terrific, very interesting. The numbers you used in that paper were the 2015 numbers. I think it was 10 billion, 9.8 billion hours, and $200 billion. Now you're using the higher number, which sounds right. I guess you had a number of solutions, some of which were administrative and a number of which were legislative. But with that kind of number, when you're talking about 11.4, you said, billion hours, there has to be a lot of room for paring this down, and there must be tremendous waste in that. Are these solutions going to go far enough, and what can we do to sort of reset the dial? I mean, coming from the healthcare industry, firsthand, I can see the enormous amount of time, for example, that physicians spend doing paperwork, and it just seems inordinate and inhibitory to any rational way to promote the core function.
That's great. Thank you for that. And if the President of the United States says that within 6 months, the secretary of, let's say, HHS or the secretaries of the 6 leading sludge generators must report to me about their efforts to produce, let's say, significant sludge reduction, or if it's not a word like significant, it could be some percent or some minimal number, then you would see massive action. And it's happened periodically. Now, not massive enough to make that current 11.4 billion, which is up from a year or two ago, 9.78 billion. Not enough to make it probably where it should be. But in the healthcare sector, I agree with you completely. The relatively recent work shows that the fact that the US has healthcare costs so much higher than elsewhere, a major contributor is administrative burdens and sludge. And this is what's pleasing about this is this really shouldn't cause any ideological anything. If it's the President of the United States should do it, and if not that, then the head of OMB. And one thing I observed, I bet Susan and Sally too, is that behind closed doors, both the deep state and the political people will agree with this. But they have so many priorities that seem higher that the paperwork reduction project just doesn't move to the fore, but it ought to. And for the president to say it must is a way of getting it there.
I would join in that suggestion as well with one cautionary note. I think somewhere between 80 and 85% of that number comes from the IRS. It comes from our taxes, which are unbelievably complicated and can drive even the most sane person up the wall. But the reason for that increment from the tax code is to provide for exceptions, to provide for deductions. In other words, to provide in many of these instances, not all, some benefit to the person writing the form. And so you have to balance the time spent with the accountability so you're not claiming deductions or exclusions or exemptions without a legitimate basis. But I agree with Cass. There's so much there, and particularly with Roger, that a lot of it in the healthcare area where the documentation has gotten totally out of control. And I would join in any effort within reason to address that. I want to join during my, I guess, non-rebuttal time to say that I concur with the idea that timing in life is everything. And just as during a crisis, you really don't want to impose a lot of new rules, I think you want to slow down, as Cass said, or put the brakes on a little bit, the deregulation as well. That hasn't been seen, as Susan's chart shows. There's a rush to finish all sorts of things that are out there. But my own sense is that you and this is where Erica was, you want information, you want data, you want experimentation, whether it's during the 6-month period she talked about, which gives us a lot from the federal government's experimentation along with Susan's state experimentation. That all goes to data, that all goes to analysis. And that should drive our decision making, not some preordained quota for getting rid of regs or imposing them for that matter.
Okay, thank you. That's been interesting, and I see that we have several questions from people who are listening. So let's open it up now. The first person on the list I see is Eric Rasmussen. Eric, I think you, yes.
Good. Yes. Can you hear me now?
Yes.
Okay, very good. Sally, if I may, I agree Trump should be condemned, but I think we disagree on the reasons. What Trump did till March was play it by the book, just like Obama would have. And he let his appointees at HHS and the FDA and the CDC handle things. And they played it by the book. The Republican political appointees listened to their expert staff. And that was a disaster because the senior nonpartisan civil service staffers kept lying and saying they had the testing situation under control and don't worry because we're experts. Then finally, Trump woke up and bumped the HHS chief from being in charge, put Vice President Pence in charge. He essentially fired the CDC and told the FDA to just let the states do whatever they wanted because the CDC was incompetent. And suddenly we got lots of tests. So what do you think of my interpretation of the story? Do you think that Trump is to blame, but mainly because he followed swamp rules and got swamp results? Oh, and Sally, your mute is on.
Sorry, thank you, Eric. I was not specifically focusing on his response to the pandemic itself and his leadership or lack thereof with respect to CDC during this crisis. I was thinking more broadly about the deregulatory world, which I would say did not listen to the experts. I think his first year and a half or 2 years in office produced one of the lowest affirmance rates in the courts by both democratically appointed and Republican appointed judges, because his people didn't follow the rules. They didn't listen to the staff. And so you have a lot of cases in the courts where the work wasn't done in terms of following the rules. And I think to characterize him as abiding by the law of the swamp is not something I would join in your comment. With respect to with this crisis, did he do that? I'm not in a very good position to comment, but as you describe it, I think he was more listening to some of the experts who did let him down. But that's a whole separate issue on which Erica and Roger probably would have a lot more to say than I.
Does anyone else want to comment on this question? We have others in the queue.
I'll say one thing. I think it's unfair really to blame anybody. If we look back at this time frame, it was so short. I mean, this was a very, very short time window in which essentially we didn't have proper information. Basically, we're operating or flying essentially by the seat of our pants. I think the president, it's hard to hold him responsible for this little tiny area called diagnostic testing that of Medicare's $850 billion is about $8 billion, and to which few people pay attention. Basically FDA followed its template that it had put in place in 2016 during the Zika outbreak, and more or less did the same thing that it did in March of 2016. I think it was bureaucratic inertia. Inertia is big, as Kev has pointed out. And so I think it's really not fair. I think the important point of this is that when they got wind of it and they jumped on it, the response of the private sector was truly extraordinary. I mean, we have done millions, over 20 million, probably 25, they're probably undercounting them, tests. I've never seen anything like the way our laboratories and the in vitro diagnostic test manufacturers, the way everybody stepped up and exploded with a proliferation of test hospitals and commercial labs and vendors, and it's truly remarkable. I'm extraordinarily impressed by it. So I think we should look at that as part of the model, as part of the lesson, that if we let the private sector do its work, it can produce great things.
Susan, you're muted.
I was just actually going to invite Cass to add something.
Well, no, that was very well put, and I have nothing to add to that.
All right, so I'll go to the next question, and it's from someone who I know, Cheryl Bolin. You're next up.
Okay, I had to unmute there. Yeah, hi, thanks. I am asking about the idea of making temporary waivers and actions permanent. And Erica, you touched on this, that this was a good sort of laboratory setting here to gather data. But I'm wondering, is it really, and I have heard a theory that if we didn't need a rule or something during the pandemic, did we ever really need it? But aren't these actions really just to address the emergency, and would they not really apply in sort of normal times?
I think that's exactly the question to ask, right? I mean, some of these things, here's an example. As what we call emergency use authorization authority, it can allow medical products, drugs to reach patients without having completed the normal extensive pre-market safety and efficacy testing authority, specifically because the balance.
Is Erica's voice garbled to everyone or just me?
Yes.
Erica, let's see if they can fix. There's something, it's not coming through clearly.
Anything on my end? Am I still garbled?
Yes.
All right. How about now? Is it still garbled?
Sounds a little like a 1960s science fiction movie where you're a space alien. Impressive.
Geosynchronous orbit, 22,000 miles above the sea. Slight delay.
University computer.
You know, we're in.
I'm muting and rejoining.
Okay. All right, so we'll give Erica a chance to log in again and respond to us. Does anybody else have comments or response to Cheryl while we wait?
What I'd want to say to this is that there are some things like SNAP beneficiaries don't have to go for interviews before they qualify. Is it self-evident that that form of deregulation is a bad idea and should not be, completely made permanent? That was meant as a rhetorical question. It's not self-evident. SNAP beneficiaries are typically, time constrained because they're poor, in part because they're poor. And so maybe you have enough accuracy without the interview. And they're probably of the 600 deregulatory actions, and I'd be really surprised if we actually have 600 deregulatory actions, but however many there actually are, it would be surprising if a small number of them were like the SNAP case. That is to say, there are probably a significant number where it's worth considering making it permanent.
Yeah, I think, let's see, I think we might have Erica back. I started to see her. I think one of Erica's points is that the benefit costs. Oh, now we see.
Can you hear me?
Oh, yeah. Perfect. You sound good.
Okay. So what I was going to say, and I'm sorry for all that, was I agree completely. I agree in a sense because take, for example, FDA has emergency use authorization authority. It can permit medical products, drugs to reach patients during a public health crisis on the basis of much fewer evidence than it normally would. We don't wait for all of the safety and efficacy data. And that is a special kind of authority that is tailored to the balance of risks and benefits that is special to a crisis. And so I'm definitely not saying, well, it was good enough during the crisis, it should be good enough normally. But there are other situations where I think regulators have made a decision because it was forced on them for one reason or another during the crisis to balance risks and benefits differently. And on reflection, maybe we think it's okay. I'll give you a different example. In my hometown, and I think this is the case in a lot of areas, the state decided to permit curbside sale of mixed drinks. Many people were ordering takeout from their favorite high fancy schmancy restaurants. I used our local CC's steakhouse and bringing the food home. And the new rule in Missouri was that they could mix you your margarita or your vodka tonic or whatever that went with it. It had to be in a sealed container with a one-time use tamper-proof lid, and you had to buy food at the same time. But you would take it home. And the state's rationale for this was, well, we're trying to help the restaurants regain some of the liquor sales. And we don't see a harm because, it harms about sort of public drinking or whatever. It was sealed and you would go home. And that's an example of one where you might say, well, did the sky fall? And would the sky fall if the state actually permanently permitted food retailers to package single alcoholic drinks to take home? I don't know, maybe not. So all I am saying is there were some deregulation, loosening of restriction decisions that were made during the crisis that we might want to stick with. And we ought to look and see, taking everything into account, whether the balance of the risks and the benefits for that particular new regulatory approach is acceptable to us.
Yeah,
and Susan, I have no problem. In fact, I endorse what she has said. There's new information, there's new analysis, it's thought through. Go with it. That's fine. If the sky didn't fall and there's a way of protecting whatever legitimate interests there were in the first instance, it should be all right. But someone should think about it. It's not just an on-off button.
Yeah, and I think that executive order that you and Erica and I mentioned, it does direct agencies to do that. So I'm hoping things like the allowance for telehealth, which has been great. Even my 95-year-old mother was able to have an appointment with her doctor without having to be exposed to COVID. So I think that there are some things that make sense, and there may be others. I think Erica's point is the benefit and cost trade-off has changed. And it may be that we learned that it wasn't appropriate or doesn't need to be, that it wasn't appropriate and doesn't need to continue. Whereas there may be other cases that say when we get to the benefits and costs the way they are in a normal situation, we do still need that regulation. Cass, did you want to say something? I saw you're off mute.
I was nodding with agreement.
All right, we have a caller, a telephone number starting with 203. Caller, we can't quite hear you. Oh, no question? Okay. Then I think maybe our Jean Meyer has a question. Jean.
Yes, I'm trying to unmute myself. There we go. One of the things that's kind of very interesting here is I particularly want to pick up on Sally's last comment because I think it gets to the center of things. You find some things that maybe clearly don't make sense, and why did we ever have that regulation? Obviously, we get rid of it. And you'll find some things where you'll say, "Oh, okay, that's why we had that regulation. Maybe it made sense to temporarily get rid of it, but clearly we don't want to permanently get rid of it." But the majority of the regulations are probably going to be in between, and where the people who are somewhat skeptical about regulations say they're dubious, and the people who are not skeptical say, or less skeptical say, yeah, it really makes sense. And it's an interesting thing because the more normal thought that I've heard about this is, well, regulation is, these crises are used usually to increase regulation. And there are new regulations put in a crisis that aren't gotten rid of. And it'd be interesting if we could get something across the board which tries to be very careful about what we take away, but also what we add, and have that be a lasting situation. I don't know if there's any way to accomplish that, but it's what I wonder about, because certainly, the point that Cass has been talking about, and I hope you're right, Cass, about this not being ideologically to have the effect, but the amount of time that people spend, including in the tax area, which is huge, but is that an argument for a huge wholesale effort to simplify the tax code, to simplify a lot of the other things that need to regulation, even if we get a slightly less perfect system as a result, but we have a lot less time being spent on it? And sort of a general thing. Maybe it's addressed to Sally, but I'm really not sure who I'm addressing it to.
I can say a little bit about that if you like. So 75% of that 11 billion hours comes from the Treasury. 25% by my calculation doesn't. So we're talking about billions that are imposed by other agencies. To have the Department of Treasury do a very aggressive effort to reassess that 75% of 11 billion would be a really good idea. To have HHS and others do that would also be a really good idea. And I want to emphasize that if we're concerned about, consumers and low-income people and people of color, often paperwork and sludge requirements come down really hard on them. And so there's a distributive as well as a cost-benefit reason to go after that. In your point, you referred, Gene, to people who are skeptical about regulation, kind of in the gray area, will say this isn't any good, and people who aren't skeptical will think this is good. You're, I'm sure, right empirically, but in a way, that way lies madness. I think with respect to both new regulation and old ones, if you think of yourself, I'm the kind of person who's skeptical about regulation, or I'm the kind of person who's positive, I wish you'd kind of bracket that when you're thinking about something like an hours of service rule, or you're thinking about telehealth. And I say that as someone who, on basis of my understanding of the data, wants deregulation in favor of telehealth, and is thinking the current hours of service rule makes some sense. Now, it may be that both of those are wrong, but whether they're wrong doesn't depend on any prior, or please, I almost want to say please God, but that's probably not, the stakes aren't high enough to get rid of. Let's say, please, America. Let's look at the data. What does the data show? And let's just bracket our priors. And I think with respect to new regulatory impositions, it might involve air pollution, where the evidence, as I understand it, suggests we could use more regulation of particulate matter, or less regulation, where my understanding is that a lot of what the FDA is doing, the deregulatory efforts of the last months, they're justified. Let's just look, and we are having a little experiment here from which we'll learn some things.
Thank you, Cass. Let me remind, Paul, did you want to add something?
Yeah, I just want to say something very briefly. I think every single one of us on the panel are big fans of making regulatory decisions based on evidence. And as somebody who has occasionally participated in a small way in some of the sort of empirical testing of costs and benefits of regulation in my own field of securities law, it's pretty hard. I mean, in the securities field, we're drowning in data. Data is, coming up with lots of data is not a problem. But even on some very, very basic questions like, okay, what's the net benefit of having rules about disclosure, which is kind of the single most basic thing we do in our field. There's still a lot of debate about what the data really tell us. So I think you also have to add a little bit of theory and a little bit of priors to what you're doing. So that's this is not, if this were easy, somebody would already have all the answers.
Yeah, I mean, one of the things that we do in the regulatory world is we spend a lot of time analyzing evidence before we write a regulation, because you have to, or you can't get your regulations through Cass or Sally or me. But we spend very little time afterwards evaluating whether our predictions in that ex ante analysis actually proved to be true. And I think spending more time on that would not only help us be able to do this, identify which regulations maybe aren't working effectively, but also we would do a better job with the next prediction if we had real data that we were basing it on.
And Susan, that was the point that I was going to make when I went off mute. And you and I have jointly endorsed some of the efforts to improve the analysis underlying rulemaking by having some metrics, asking the agencies to tell us how you would measure success. I guess that means first describing what is success, and then how would you measure it, and using that to review not only whether that particular rule has fulfilled its expectations, but also whether the methodology, more broadly applicable, should be adjusted in some way, shape, or form. And I think we're all speaking of the same kind of thing. And yes, Paul, it's very difficult and it's time consuming, and for some it's mind-boggling. But I think the effort of trying to think through what you're doing and analyze the consequences, it has to be good. And I think that's what I was trying to say in my opening remarks. I haven't seen a lot of that in some of the early deregulatory efforts of this administration, because they haven't been looking at the benefits. And if we can focus on the data, albeit difficult to, if not assemble, analyze, then I think we'd all be better off. And I don't mean to come across as some extreme view of this, because I join virtually all of you in your understanding of the situation facing us.
I'll just add one more thing related to the notion of our priors that I think Paul and Cass and Jean all mentioned. Agencies themselves may not be the best equipped to evaluate their own regulations given their priors. So some kind of body outside of the agency itself having some role there, I think, could improve things. Now, we do have another a question, and let me remind people on the phone that if you have a question, press star and 9 on your phone. Michael Hertz.
Hi, everyone. So far, the discussion has been about movements towards greater or reduced permanent regulation sparked by a moment of crisis. But the other thing that happens in moments of crisis is non-permanent changes, that is, variances. And variances, I always felt like variances are like the least well-studied, the most under-theorized part of administrative law. They tend to be invisible. The sources of legal authority are sometimes obscure. No one quite knows what's going on. But I'm wondering whether any of you have thoughts about variances as opposed to permanent change, whether this is a moment to start thinking more seriously about variances, whether there are any lessons about variances that might be drawn from this time going forward.
Great question. Paul, you look like you've got something to say.
Well, I'll just follow up on my last observation, which is one of the fascinating things is when you get the variances that are known to be temporary, it becomes even harder to interpret whatever data you end up generating, because you get the argument that's not a completely unreasonable argument that, well, people knew this was going away and they didn't actually want the regulators to know exactly how they would react if this were if this change were going to be made, and so their behavior doesn't really reflect what the behavior would be if this were a permanent change.
Sally.
I think Michael raises a good question, because when you study rulemaking, one of the first things that you alert students to is that it's probably bound to be over-inclusive. Just the formulating of a rule is going to sweep in things that either you weren't thinking about or weren't intended. And unintended consequences are not happy pieces in the puzzle. So whether there's variances or waivers as part of the actual process is something which I think is generally salutary and should not be frowned upon. And if during this period we learn some things that would enable us to better craft those exceptions or waivers or variances, I'd say all for it. Because once you do rulemaking, it's there across the board for all concerned that are covered, would be my thought to Michael's question.
Well, my only concern with that is that it gets a little bit to Cass's sludge concerns, is that the people who, or the entities that are sophisticated enough to get the variance, it may leave out those that don't have the connections or don't have the sophistication about how things work. So I'd worry a little bit about crafting all-encompassing rules and then allow the well-connected to peel off pieces that they don't have to comply with. All right, I don't see any questions. So I think if we'd like to just quickly go around and have any final words. Cass, you have another appointment, so why don't you go first?
Okay, so I'd say we have two themes that have emerged. One general theme, which Paul eloquently presses, and with some of the points made by others put in bold letters, is that in a crisis you might make a big mistake. So to be careful about legislating, certainly, and maybe regulating or deregulating is a good cautionary note. The second idea is to have, let's call them partial reforms that are going to relieve pressure, either health pressure or economic pressure. It could be sludge, it could be waivers, it could be variances, is a pretty good idea, so long as you have an attitude of living and learning, rather than an attitude, Sally's point, of pressing forward with something you really wanted to do anyway, but for which you lacked evidence. And that's a very, very good organizing principle, I think, for the next 6 months.
Okay, that's great. Do other people want to, should we go through again as we started? So Paul, that means you're up first, and Sally will have the last word. Paul. Sure.
So I look at the comments of my fellow panelists, and I think we mostly agree that we ought to be a little bit careful in a period of crisis about doing things that will outlive the crisis, but whose logic may have been may terminate after the crisis. I think we've all been very much interested in making sure that we get the best evidence that we can for purposes of rulemaking. But while at least my view would be, being a little bit attentive to the fact that there are always going to be some differences of interpretation of the data. So I think we have a lot of areas of agreement. One thing I'm going to say very quickly, just to repeat something Roger said, I do recommend Cass's, especially now that he's gone, Duke Law Journal article to everyone. It really is an important point, and I think he's exactly right that this isn't just an efficiency issue; it's also a distributive issue, and one in which we can probably get a good distributive outcome without much cost to the economy as a whole.
Thank you, Paul. Erica, do you want to go next? Any final words or thoughts?
I actually feel as if at this point we've sort of found ourselves violently in agreement about a lot of things. I'm not sure what more I want to add. I think, it's kind of strange to talk about a silver lining at all, but of the current situation. But I've always thought that we should be looking at all of the regulations on the books, everything, especially things that have been around for a really long time. I would say especially things that create this sludge problem, as Cass said, and to think about why we put it in and what it's bringing us and how much it's costing us. And a lot of it's going to stay on the books. FDA's new drug approval standard, I'm a big fan of. A lot of it's going to stay on the books, but I like the fact that we have new data, and we can have, when people are calmer, when everyone can reflect and think about what we've learned, I think we could have some important and really helpful conversations about what we've learned about the regulations that were on the books. And I look forward to that conversation, but I think it probably can't really happen well until next year at least.
Thanks. Roger.
Yeah, so this has been a great discussion, and and while I agree with Paul in terms of making sweeping changes, I think it's a horrible time to do that right now. I think that a lot of what's being done to meet the current epidemic has been extremely useful, both in terms of providing the flexibility to move forward, and as a model in terms of potential changes that we may want to implement on a permanent basis in the future. And I'm looking most specifically in the healthcare arena, where I think at the nuts and bolts ground level, it tends to be less politically charged. Separating that from higher health policy issues, I think operationally and functionally, people tend to want to be pragmatic in this area. And I think much of what's been done, in preparation for this, I went and I looked through the regulatory changes that have occurred in the healthcare field, and you really have to do a deep dive to understand them. And what that says is that this is intensely regulated. Pretty much everything a hospital tries to do is regulated. We have all sorts of issues right now with not only with broadly with cost, but also the concern about potential lack of competition, for example. And some of the regulatory changes that are being made are really will really, in the end, provide potential routes to increasing competition, which should improve quality and lower costs. So I think I think this has been a great opportunity to implement changes to meet the exigencies of the emergency, but then really is an opportunity in many restricted spheres to learn, gather empirical evidence, see if it works, and then potentially in a time of less tumult, choose to maintain some of these changes in order to improve the quality of what we're doing going forward.
Thank you, Roger. And Sally?
I would join those who say we are in violent agreement about all sorts of things. And I think we, in fact, are. And a lot of very good and constructive points have been made. I think we do have a chance to learn some things. But what I would hope is that we would open the lens and think about this not just from the point of view of the regulated entities, but what I call the regulatory beneficiaries. And if you say you want to think about why this was done in the first place, that's part of the that's part of what you're looking at, is what was the failure, the market failure or whatever that led to the adoption of a regulation in the first place. But it's more than just the business. I don't believe in trickle-down economics for tax purposes. I don't believe in trickle-down economics, if you will, for regulatory purposes. I think there are entities who have equities involved here in maintaining clean air, clean water, safe food. You notice I'm focusing more on the environmental and on the labor than the health area. But there are so many things in the mix. And I would hope that whatever decisions are made, they be evaluative, they look at the data that we have, but they look at it from a lot of different perspectives. And otherwise, I want to thank our moderator and fellow panelists for a very enlightening discussion. Thank you.
I would also love to thank, well, of course, the Federalist Society and our panelists. I'm so happy to have moderated a panel where our conclusion was evidence-based policy is the way to go. So thanks, everyone. Dean, did you want to sign us out?
I just want to thank everyone for participating. Appreciate it very much.